Our mission is building healthy communities one neighbor at a time through patient-centered healthcare regardless of income or current state of wellness. And essentially our vision is we take care of everyone. We never turn anybody away for their inability to pay. And our goal is to make sure that all patients get all the care they need. And it's really important because a lot of times people can't pay for health care, but they need health care, and they need to come to a location where they feel safe and cared for, and we're that location. We have passionate providers that care deeply about the work that they do and the patients that they see. As a federally qualified health center, 51% or greater of our board must be patients, 60% of our board are patients. It's a great value because we hear their stories, their patient story, the experiences they've been with other organizations, and they've come to Neighborhood Health Center. They love their providers. They call them by, go team Dr. G, go Dr. P. They love our doctors and our providers. And when they come in the door, our front desk knows them by name. They're not a number, and we work really hard to bring them in on a regular basis. And we have long-term providers that have been with us since we opened the doors 10 years ago. 2020 we'll be celebrating 20 years. And it's just a really exciting place to be. They were a federally qualified health center, and as a marketing specialist, I didn't have a lot of digital experience. But what I understand is we have to reach our patients where they're at, and they're not your normal patients. It's not retail advertising. It's very specific, and it needs to be targeted. But we don't have a very large budget for marketing, so we needed to find a way to get to the patients that we needed to get to tell them about our services and do it in a way that was cost effective. So we heard about the Google Ads grant, and we got the grant. We were thrilled to have the grant. I spent about 2 years trying to manage it myself, and I had a lot of problems with that because there are a lot of kickback from Google around this ad's not running, that ad's not running, you need to fix this, you need to fix that. And I found I spent a great deal of time trying to hunt down Google to get these answers, only to find they're crawling our website because there's something on the website they don't agree with their policy and had nothing to do with my ad, had to do with their policy. So we found we weren't really effectively using the ad grants. We weren't using the money that was on the table for us to use, and we weren't reaching patients in the way we needed to. And our numbers were really low. So we had the opportunity, Jerry reached out to me, I had a conversation with Jerry, then I got the opportunity to talk with Keaton, and we started realizing there's a really good way to have somebody that knows Google Ad Grant better than I do, that can manage our grant and help us really see that increase. And that's what we've seen since February of 2019. We've seen a huge increase in terms of the number of people that are reaching our website, the number of people that are calling, and we're now starting to see an increase in our services because we're targeting specifically the patients we're looking for, and that's Oregon Health Plan, that's Medicaid, that's people seeking help that need help, don't know where they can get it. They want to find a place where they can come in, and they're not worried about being turned away for their inability to pay. They want to worry about whether they have insurance or not. We're going to see them no matter what. They need to know that, and our ads can express that. And what we have found that we've gotten 3,500 new users off of just being able to use the Google Ads grants effectively by using CRF to do it, because I couldn't do it on my own. And we're also now seeing phone calls coming in on a regular basis, which we didn't before. We had no way of driving those phone calls to our call center. And we implemented a call center at the first of the year. And now that we have it in place, this now drives those calls. And on average, we're getting some 55 calls a month based on these advertisements. So we're really seeing a return on investment, and we're using the money that was on the table that we weren't using before. And it's only costing us to work with a group like CRF. And